All right, guys, we are going to do a step-by-step process of how to walk your client from beginning to end of their teeth whitening appointment. So many things need to happen throughout these steps, but the number one priority to remember at all times is we, as service providers, are not touching our client. We are not applying anything to them. We are just walking them through the process to get the best results possible. So first things first, through your steps is you always want to have your clients fill out their consent form. Remember that you have that in your training manual. You have the consent forms that is going to be, you will be able to edit to put your logos on and do all of that fun stuff. So he will go ahead and he will fill out his consent form. Information about consent forms is in your training manual as well, in terms of how long to keep them, and all the information that needs to be on them to have it completed the correct way. So once he's done with his consent form, then we want to make sure that we record our starting shade for your client, and it's a combination of again, making sure that we're looking at the different colors of the teeth, because not all the teeth are going to be the same color, especially like canine teeth, incisors in the front. So you want to kind of pick a shade that's kind of going to balance out all of them and make sure that your client agrees with that shade that you're going to start with. So you can hand them a mirror. You can use your teeth whitening or your dental shade guide here to pick out some colors, and they come out, so you're able to like move them and kind of put them next to teeth to kind of determine which shade is the best for them. So we're gonna go with this one. What number is this?
18.
All right, so we're gonna do S18 for his starting shade. And then on your consent form is where you will put your starting shade on that consent form. So last thing we're going to do also for that is take a before picture before we start the whole process of the application of the gel and stuff. So I did a whole video on how to do before and after pictures and the tips and tricks that I think work best for that. So you just want to make sure that you get your before pictures before your clients put their cheek retractors in if you can, so you don't get all the gums and the teeth that look all funny. You want nice and natural smiles as much as possible. So nice and natural smile as close up as you can get, and we just want the teeth, natural smiles, but you also want to be able to get the teeth just like that. So nice natural smiles for your before pictures. All right, then you want to make sure we put on his dental bib, because trust me, this is a dirty job, and we want to protect our clients' clothes from getting wet. There's a lot of saliva, water, mouthwash that goes into this appointment. What I like about the clips that I put in your training kits is they're adjustable in the back, so they can work for anybody's size or shape when you're putting on those dental bibs for them. All right, so then you want to make sure we put our gloves on. Okay. Now, first thing we're going to do is hand our clients a oral brush up to brush their teeth, and it's totally fine if your clients want to brush their teeth before their appointment, but we're still going to do that when they come, because we actually have the granulated toothpaste that will actually help remove the top layers of plaque and any kind of stuff that they may have on the outer layer of their teeth. So they don't necessarily have to brush them, because we're going to brush them anyways. So I want to hand my client to the oral brush up, and I'm going to have him open this up. Have your clients do all of this stuff. That just assures that you're not practicing dentistry and they're just walking through this service with you. So I'm gonna hand him the oral brush up. He's gonna open that, throw that in the trash. This will be your best friend. Keep this trash can near you. So go ahead and pull that out of there. It's a little toothbrush sleeve. We're gonna put our finger on the inside of it, and we're gonna brush with the blue side. And then we're going to put a pea size of the Impressive Prep. This is really important. This granulated toothpaste is really important to get all that top layer off of their teeth, so that that gel has a chance to penetrate past that, and it doesn't have to work harder than it's supposed to. So just a pea size amount is all you need, and then we're going to have him brush really good. Lots of napkins also. So I keep napkins on their lap while they're doing this in case it makes a mess, which it can. All right, so brushing his teeth, then I'm gonna pour a cup. I already have some poured of just water. You don't need mouthwash for this. Water will work perfectly fine, and have that ready. I like to have the little small water bottles here for each one of my clients to be able to use that. All right, trash can. Go ahead and take that. Go ahead and rinse really good for me. Spit right back into that cup. Make sure you take your trash can away from your client. Oftentimes they mistakenly think that if you have this too close to them, you want them to spit into your trash can. So kind of make sure you move away from them if you can. Perfect. That goes right in here. Awesome. All right. Next step is we want to hand our client the cheek retractor. So I'm using these new plastic cheek retractors. Some of the older ones, the plastic or the latex ones, were a little bit difficult for clients to use. So I'm using these plastic retractors in large so that we can get as much surface area of the teeth without having the lips interfere with whitening gel with the process of the whitening appointment. I do suggest that you have an extra one of these in a plastic bag next to your whitening station, just so you can kind of show them and demonstrate how this is supposed to go in. Some people want to put this straight in, so you got to give them really good instructions on how to put this in their mouth. So basically what we want them to do is put their lips on the side of each one of these little side pieces here, so that this little piece here actually hangs down. And we want to make sure it's in front of the teeth so we have full access to the teeth. So go ahead and put that in. So as he's doing that, now I want to make sure I have one of these vitamin E and aloe swabs ready for him. I'm going to actually have him, or pass it to him and have him push the Q-tip through the plastic so that he's the one opening it. He will pull it out of here, break the top part of this, and watch the aloe and the vitamin E go down into the bottom swab so that he's able to apply it to himself just at the gum line. We want it right where the gums meet the teeth, so that way we can protect if he has any cuts, abrasions in his mouth at his gum line, that teeth whitening gel doesn't irritate it at all. We want to make sure we don't get any of that gel on there. So I'm going to hand that to him. He's going to push that Q-tip through that plastic. I'll take the trash. Go ahead and break the top part of the lid off, or the Q-tip off. Take that, and then watch as the gel comes down into the bottom of that swab. I'm going to hand him a mirror so that he's able to do that. And you really do want to watch and pay attention that they're getting as much of that gel on those gums as possible. That vitamin E and aloe swab gel is very important to this entire process. This is what's going to help from not blanching your client's gums and protecting them as much as you can. It's super important. We want to make sure that this is not a painful process for them. All right, have your trash can ready. All right, now keep that mirror there for your client, because now we're gonna actually hand him his teeth whitening gel pen, right? And so what I like to do is have this ready. While he's doing that, I kind of like to turn this gel pen just a little bit to help him get ready for it, because sometimes there's a lot of air in this gel pen, so have it ready for him. Also at this time, if you have a recliner or if you have a chair where you're able to recline your clients, this is probably one of the best times to do that. As he's been sitting here for a little bit, depending on your clients, if they produce a little bit more saliva, they're going to start feeling that at this point. So we want to try to get them to recline for a second if he can. So let me have you recline. Perfect. All right, so now I'm going to hand him this teeth whitening gel. What I like to explain to my clients at this point is this is more of a painting motion than it is brushing. I want them to individually brush this gel onto their teeth. from canine tooth to canine tooth, both on top and bottom. We're going to get the canines and the incisors. Anything back behind that in terms of their teeth, that LED light is not going to penetrate that, and we're not going to be able to whiten those teeth. So it's really just like the front surface teeth that they can see, normally from canine to canine. I usually will have a napkin also where I can show them how much gel I actually want on each one of their teeth. And so I do a light little layer on here so that they can see how much I actually want applied to their teeth so that they know how much they need to get on there. I don't want them brushing this on, because if they just brush the gel on, it's going to be extremely, extremely thin, and the buildup of the saliva in that can actually lessen the power of your gel. So you really do want like a painted, thicker layer on each one of these teeth. So I'm going to hand him this, and then we're going to go ahead and we are going to paint that gel onto each one of your teeth. And I really do want to pay attention to and watching how he's applying this. I want to make sure he doesn't apply this to or get any of this gel on his gums, because remember, we put that protective coating with that aloe and that vitamin E gel on those gums. So I don't want to get the gel on there to irritate his gums at all. So I want to pay close attention. I'm also listening for the sound of the twist of that pen, because I want to make sure he's getting enough of that gel on the, those teeth. So kind of listen at the same time when you're doing all this. All right, so as he's doing that, I'm gonna get my LED light ready. I wanna make sure that it's set for 15 minutes at 100% power. If you have an LED light that has red and blue capability to work together, that's awesome. We talked the red light on the wavelength of the red light actually has cellular energy in it and actually will help healing process of the mouth. But if you don't, that's totally fine. But I want 100% power, red and blue if I have the option for that. I want my light to be at 100% power. I want it set for 15 minutes. So that way once he's done applying that, I can put this right on there, and then the process of that can start. Now remember, I also let him know that tingling is totally normal, especially for people who either have sensitive teeth or haven't done a teeth whitening treatment before. Tingling is normal, but there should never be pain. And the instant that they feel any type of pain, they need to let me know, so then I will stop treatment then and there. And it just may be that teeth whitening just isn't for them and for their teeth, and it just may be too sensitive for them. But tingling is totally normal, so I set those expectations for them before we set that light on top of that, okay? All right, so now we got the teeth whitening gel all nice and thick over those teeth. Now I want to take these protective glasses and we're going to put them on, or he's going to put them on. Okay, now he's nice and comfortable. Everything is good. Now I have my LED light all set and ready. I'm going to go ahead and start this. I like to start it away from them, because then I can kind of maneuver the perfect position for it. Because if I put it too close, I don't want to move that around them and actually hit them with this LED light. So I can start this now, here. So the positioning of the light, you really don't want the light to actually touch them. You just want to encompass the entire part of the mouth to where the edges of your LED lights kind of sit exactly towards where the LED light sits on the surface of that cheek retractor, because you're going to have the plastic on the outside. I don't want it resting on them. It shouldn't be heavy. Those LED lights get kind of, they can get kind of warm, not to where it would burn them, but we don't want that too close to their skin in case something does actually start to hurt. So we're going to keep him under here for 15 minutes, the first set of 15 minutes. During this time, in between the two 15-minute sessions, I want to make sure that I am checking on him every 5 minutes, making sure he's comfortable, making sure that he doesn't have any pain, and making sure that his teeth haven't shifted, or he hasn't shifted in the position to where the LED light may not be directly where I want it to actually be. Another thing you want to talk to, or make sure that when you set that LED light on them, the cheek retractor sometimes can force their mouth to open a little bit. We want to bring those teeth together as much as possible, because if those teeth aren't together and he just has an open wide mouth, that LED light is literally going to the back of the throat. It is not getting the teeth that we want to whiten. So when you put them underneath this light, make sure to ask them to bring their teeth together as close as they can so that we can penetrate and get that light directly on their teeth. So he'll stay under here for 15 minutes. We'll check on him every 5 and make sure he's doing okay. Then we'll do a rinse and we'll reapply, and then we'll do another 15 minutes. All right, guys, here is a look as to how much gel should really be applied to your client. You want like a thick layer on there, but look at how none of that is on his gums. It's all the way just around his teeth. That's the type of application we want for each one of these 15-minute sessions. All right, here's an up-close look as to how your client should be positioned with their LED light. Okay guys, one thing or a couple things I wanted to bring up really quick while we have our client sitting here processing. Make sure you're going to go through a lot of gloves. So make sure that in between each one of your sessions, while you are letting them sit here and you're doing other things for those 15 minutes, maybe you're on your phone or you're doing paperwork, handling other clients, please make sure to dispose of those gloves and use a new set of gloves every single time you start to interact with your client. So you're going to go through possibly 2 to 3 different pairs of gloves in each session. And then the other thing I wanted to talk about is after your client is applying their teeth whitening gel, we do want to go back and kind of make sure we clean up any areas that may have gel on the gum line, and we want to do it very lightly because we really don't want to take that aloe and vitamin E that we've already applied, but we do want to clean up any of the gel that may have gotten onto their gums after the application. Sometimes we get really excited, we want to put really heavy-handed with our gel, our clients do, and so it may be a little bit too much and it may have gotten onto their gums. So we just want to kind of come back in right before we put that LED light back on them with their protective glasses. Just kind of go in there and just kind of make sure that your client, they do it. Obviously we're not doing it, but make sure they go in and they clean up the gum line really light-handed to catch any of the existing whitening gel that may be on their teeth or their gums. All right, guys, so our timer has gone off for the first 15 minutes. So the things you want to have ready are your trash can. You want to have some napkins ready. What we're going to do is we don't want your client to come up too quickly. Remember, they might have a little bit of collection of saliva in their mouth. I want to have my napkins ready, so when I pull this LED light away from him, I can hand him the napkins. He's going to pull out his cheek retractor into the napkins and then hand it to me so that I can like blot it off for him. Then he will gradually come up. I will have an empty cup for him to spit if he needs to get any saliva out of his mouth. And then we can do a rinse with just water, and he's going to use his tongue to get all of that gel off of those teeth. Okay, so let's take this LED light away. I'm going to give you the napkins, and then I'm going to take these LED or these protective glasses off. Go ahead and take that cheek retractor off, and then you can hand that to me. He also has some napkins here on his stomach just in case he needs to use them. He'll go ahead and he'll hand that cheek retractor to me. Then I'm going to have him come up a little slow. I'll hand him a cup if he needs to spit and get any of that saliva out of his mouth. Again, trash can's your best friend. Get that out of there. You have some napkins on there. Go ahead and take this water. We're going to do a really good rinse. Use your tongue to get all of that gel off of your teeth. Have your trash can ready. Go ahead and put that in there. I give them a minute just to kind of loosen up those lips. They've kind of been pretty wide for a few minutes. How's that feel?
Good.
How your gums feel?
Good.
Good. I want to make sure in between each session your gums feel amazing. It is so important to make sure that we're taking care of that. All right, so now that we are done, we've gotten all of that gel off of his teeth. We're ready to go back in. So I want to take this cheek retractor that he did use. I'm going to kind of just wipe it off for him, get all the saliva off of it, because we're going to use this same cheek retractor to do the next 15-minute session. All right, so go ahead. We're going to reapply that. Then I'm going to have my Q-tip for, or my swab with my aloe and my vitamin E, to have him again push through the plastic, tear off the top piece, watch the gel come down into the swab and reapply to just the gum area. You need to do this every time you do a 15-minute session. So I'm going to have you go ahead and push that through there. Break the top part off of that swab. Have your mirror ready so that he can apply that. All right, now we are gonna hand him his teeth whitening gel pen and let him actually recline again so we can get this applied as good as we can. So you take that. All right, second 15-minute treatment is done. We're gonna get our napkins again ready to let him get that cheek retractor out of his mouth. I'm gonna pull this LED light away. Here are your napkins. We'll take off these glasses, the shades. All right, go ahead and take that cheek retractor out. I have, again, an empty cup for any kind of saliva we need to get out of his mouth. I have some mouthwash ready. Now is when you're going to use your mouthwash. This is the end of the session. So we'll take that cheek retractor. Take that cheek retractor out. This is going to go in the trash now. Go ahead and come up a little slow. It's for you to spit in. Okay, and he's got some napkins on his lap in case he needs them. Put that away. All right, so now before we do the rinse, this is when your second oral brush up comes in. We're gonna get all that gel off with a little bit of our granulated toothpaste. So hand him that oral brush up. He's gonna open that up just like we did the first time. He'll put his finger through the little sleeve in there, and again, we're gonna brush with the blue side. We'll put, again, a pea-sized amount of your granulated toothpaste, your Impressive Prep. A little goes a long way, so you don't need too much. Go ahead and brush really good. Have your trash can ready? Get it all out of there. And then now he's got his mouthwash. And we're just gonna rinse really, really good. Again, he's gonna spit right back into that cup. Take your trash can away. Don't let him spit into your trash cans. All right, put that in here. All right, how your gums and your teeth feel?
Good.
All right, perfect. So now we're gonna use the last of your vitamin E and aloe swabs. Again, this is just for the health of their gums. We wanna send them home. If for a chance we did blanch a little bit of their surface area of their gums, totally okay, totally normal if that happens, but this aloe swab will instantly help soothe any type of sensation of irritation on their gums. So you're gonna hand that to him. He's gonna push that whitening or that swab through the plastic. And then break off that top piece. And then into those gums. And then this is normally the part where they get the first chance to look at their teeth after they've completed the whitening session. So they're normally really happy at this point because they're like, wow, I can totally see the difference. Now remember, your clients are gonna get whiter for the next 24 hours. Whatever shade that they are at this moment, they're probably gonna be a shade, maybe even 2 shades lighter within the next 24 hours. This whitening gel is actually activating and working for 24 hours with that carbamide peroxide, which is awesome. So now we'll get that gel on there. Have this ready, okay? And then from here, what we want to do is now we want to do our before or our after pictures and our after shade for your client. So go ahead and sit up for me. Okay, and at this point, you can take off that dental bib off of them. You're not going to use anything else in terms of anything that could get wet. So nice and bright smile with your mirror. And let's look at where you're at now. Oh, wow. 12. All right, so I think we got 2 in S12, which is what, 1, 2, 3, 4, about 4 shades lighter just in that treatment. And again, he's going to be a little bit lighter by tomorrow. So the aftercare, of course, we want to make sure we give him really good aftercare instructions, and those all come in your aftercare cards. And the basic instructions is nothing to eat or drink for the next hour besides water, and then nothing to eat for the next 24 hours or drink for the next 24 hours that is going to be staining to the teeth. Our teeth are really porous at this point, so anything that has a lot of staining properties to it is definitely going to get into those pores of their teeth. So stuff like coffee, red wine, spaghetti sauce, tomato sauce, blueberry, stuff like that. So you'll have a list of all that for them. If they have any sensitivity, if they do have any blanching of the gums, I've taught you guys how to address all those issues with your client. So I do give him his aftercare card. And then what's really awesome about the teeth whitening gel pens is there's probably enough gel in here for him to do maybe one more 2 15-minute treatments. So that's really awesome that he can do like a follow-up treatment with this. So I give him his gel pen in the bag that it came in because all your supplies are used, and he can take this home. The pens are good for 3 months once they're opened. I put his name and the date that he came so that he knows he has 3 months to come back with this pen. And it doesn't need to be stored in any particular way, just as long as it's not in extreme heat. So I don't prefer they leave it in their car. But we'll go ahead and we'll put the pen in his bag, write his name on it and the date, give him his aftercare card, and send him home. But we want to make sure we do after pictures. I always forget this part. So make sure we do really good aftercare pictures. And we want to do the same position that you did your before pictures. So if you did have the cheek retractor in, put the cheek retractor in. So we want to get the same lighting. I do a couple different things, and we talked about that in the before and after picture video. So that is it from beginning to end of a teeth whitening session. I hope you guys love this. If you have any questions, of course, you guys can contact me. Thank you, sir.